Hi, I'm Dr. Ben Roach, one of the optometrists here at Berkeley Eye Center. You'll likely see myself or one of my associates for some of your post-operative care. The purpose of this video is to get you prepared for your upcoming cataract surgery. Our counselors will be helping you with scheduling 6 total appointments if you're having surgery on both eyes. 2 of those will be your surgical dates, and the others will be post-operative visits. It's a requirement that you have a driver with you for each of the surgery days, and it's highly recommended for your one-day post-op visits as well. On the day of surgery, you must have someone with you over the age of 18 that stays in the lobby the whole time you're at the surgical center and should plan to assist you in getting settled once at home. You and your responsible party should be prepared to be at the surgery center for 2 to 3 hours on average. You'll receive at least 2 phone calls prior to surgery. The first call, about 5 to 7 days prior to surgery, will be from a patient service representative who will outline your financial responsibility. They'll take payment that day over the phone if you're able. If you're unable to pay your out-of-pocket expenses, a final attempt will be made 3 days before surgery. If you still cannot meet your requirements or we cannot reach you, you will be canceled or rescheduled to a later surgery date. Please keep in mind that all patients must prepay. No money will be able to be collected on the day of surgery. The second call that you will receive prior to surgery is from a medical assistant approximately 3 to 5 business days before surgery. This call will be to provide the arrival time and to remind you about the need to be fasting for the procedure. On that note, you cannot have any food or beverages for 6 hours before your scheduled surgery. You are able to take your normal medications with a small sip of water. The exception to this is any diabetic medication, which you should refrain from taking on the day of surgery. Properly using our prescribed eye drops after surgery is essential to healing. Our counselors will help with ordering these drops, and there will be information on how you will use them in your provided folder. You'll use your first prescribed drop after surgery once you are home and settled. You do not need to use these drops before surgery. At the time of your evaluation, you'll be given a black surgical bag, which you need to bring with you to your surgery. We recommend putting your ordered drops in this bag. You will also find 2 lid scrub wipes that you should use to clean your eyelids with the night before and morning of your surgery. We recommend taking a shower and washing your hair the night before surgery instead of the morning of. As far as what you should wear, you will not need to change into a surgical gown at the center. Plan for flat-heeled shoes, comfortable pants, and a shirt that buttons down the front is preferred for ease of placing EKG leads. You should avoid any cosmetics or moisturizers on your face. We understand there's a lot of planning, and of course plans can change. Should you decide to change the surgical package you desire, we need to hear your request at least 2 weeks before your surgery date. This will allow us enough time to make necessary changes to the paperwork and ensure we have the proper lens available at our center. Please contact your surgical counselor directly to make any changes. Their business card will be included in your bag or your surgery folder. On behalf of Berkeley Eye Center, we thank you for choosing us. We look forward to helping you through this process towards better vision. Please take time to review all the forms included in your folder or have a family member help you get through them. If you have any further questions, please don't hesitate to reach out to us.